In the last portion, we have seen regarding care of surgical patient. Now it is a continuation of care of surgical patient. So this is perioperative nursing. So this topic is usually asked for 5 marks or sometimes for 10 marks also. Perioperative nursing care. Now first of all, before deciding what is perioperative nursing care, it is actually delivery of patient care during preoperative, intraoperative and postoperative period. So that is particularly referred as perioperative nursing care. So we can tell that perioperative means it is a total span of the surgery, that is entire procedure when we are carrying out the surgical activity, that is referred as perioperative. In simple terms, we can tell that perioperative means it is a nursing activity carried out before, prior or before, during and after the surgery. So that is referred as perioperative nursing. So this is the definition of perioperative nursing. So remember the term here, peri is different, pre is different. Peri means, perioperative nursing means it is a term that is referred to the entire span of surgery. Now entire span of surgery refers to the process before the surgery, the process during the surgery and the process after the surgery. So all these three stages are referred as perioperative nursing. So this is the same thing. You can draw this figure also when it is coming. Perioperative nursing means you can draw. It includes preoperative phase, the intraoperative phase and the postoperative phase. So as a whole, we refer that these are the three phases of perioperative nursing. So the first phase, as I have already told, preoperative phase. Okay. So perioperative phase means, perioperative nursing care means it is including all the three phases. Okay. Preoperative, intraoperative and postoperative. Now preoperative phase means it is a phase when you are deciding to conduct the surgery. Okay. So the phase, it starts when the surgeon decides for the surgery and until the patient is transferred to the operating room or until he is placed in the operation room table. Okay, so that is referred as a pre-operative. Pre means before. Okay, so it is a time period when the surgeon decides for the surgery and all the nursing activities that is happening during this stage and until the patient is shifted to the operating room. Now, in certain cases, what happens is the perioperative phase may be very short or sometimes it can be lengthened. Now, most of the time, in case of in emergency cases, maybe in case of accidents and all, this preoperative phase is very short because immediately the patient may be shifted to the OT. Okay, or sometimes if there is an emergency appendicectomy where they will have to remove the appendix of the person. In that case also the preoperative phase may be very short because there is no much time to prepare for the surgery here. Immediately the patient is shifted to the operating room. But certain surgeries, it may be a long preoperative phase. For example, if they are waiting for a transplant, especially a heart transplant or kidney transplant and all, they may have to wait for months or years together because they have to get a donor. Okay, so in this case the preoperative phase is very long. Or sometimes if the patient has to undergo a cardiac surgery, in that case also they will have to wait until the whole time is very feasible. Maybe the patient has to recover, all that they will wait. Okay, so that time the preoperative phase will be usually taking a longer period because they need long time for the preparation. Okay, so preoperative phase means it is a time period before the surgery actually happens. Next is intraoperative phase. Now intraoperative phase means it is a phase that begins when the patient is transferred to the OR. OR means operating room, and it ends when the patient is shifted to the recovery room, or we also call the recovery room as post anesthesia care unit. So most of the time the entire procedure here In intraoperative phase, the patient will be transferred from the operating room, that is from the OT, to that of PACU or the recovery room. In intraoperative phase, what happens is the surgery will be conducted, and here the patient will be usually anesthetized before the surgery, and usually they are draped, and then the surgery will be performed. So this much things happens in the intraoperative phase. Next phase, that is the last phase, is post-operative phase. We are dealing regarding all these three phases in detail. Okay, so post-operative phase means it is a time period when the patient is shifted to the recovery room. Okay, recovery room is also called as the post-operative ward. Sometimes it is also called as post anesthesia care unit, that is PACU. Okay, and in post-operative phase, until the healing is complete and the patient is sent out, that is referred as post-operative phase. Now, most of the time, the post-operative phase is again more important, because after the surgery, chances are there that there will be some complications and all. So chances are there that patient may not recover also. So post-operative phase have to be, the nurse has to give adequate nursing care in post-operative phase. Next, we will see in detail now pre-operative care of the patient. We will see regarding detail regarding pre-operative care of the patient. Sometimes the questions can be asked like this: how will you provide the pre-operative care for a patient with abdominal surgery or with cardiac surgeries and all? So the answer remains the same for all the surgeries. The preoperative care will remain the same, but certain things may be differing, especially the skin preparation or preoperative teaching, and other things may slightly vary. But otherwise, the answer remains the same. Okay, so first we will deal regarding detailed preoperative care of the patient. Now, as I have already told, preoperative care means it is a care that is provided to the patient before the surgery. Okay, so entire activities which you provide to the patient before the surgery until you are shifting them to the operating room, that is referred as preoperative care. So under that we have got preoperative assessment. So under preoperative assessment we have got review of the preoperative lab and diagnosis. That is, what we exactly do is we have to conduct some blood investigations, we have to conduct some diagnostic procedures, that all things will come under this one, review of preoperative laboratory and diagnostic studies. Next comes is review of the client's history and preparation of the surgery. Usually this is done prior to the diagnosis, okay, but I am just dealing regarding all of it. Okay, so what you have to do is before the surgery you have to collect the health history of the patient, you have to perform thorough assessment, and you have to prepare the patient for the surgery. Then next is assessing the physical needs. Once you have assessed physical needs, you should also assess the psychological needs. Now all this I will deal in detail in the coming slides. Okay. Then next comes is assessing the cultural needs of the patient. Next comes psychosocial assessment. It is somewhat similar to your assessing psychological needs and cultural needs. Next comes is psychological preparation. Okay. Then comes legal preparation, means taking consent. Then comes is spiritual preparation. Then preoperative preparation, that is by giving some preoperative teaching to the patient. Okay, remember preoperative preparation means you are giving some preoperative teaching actually. Okay. Next comes is physical preparation. Physical preparation could mainly include your skin preparation. Next is immediate preparation. It means the preparation that is done just before the surgery, what you will do immediately before sending to the operating room or the operation theatre. So first of all, review of laboratory and diagnostic studies. So as I have already told, once you have collected the history of the patient, once you have done the physical assessment, then comes is performing all the lab investigations and performing all the diagnostic studies. Now under the diagnostic studies, mostly you have to do complete blood count. It means CBC. Okay, under complete blood count we have got hemoglobin, TC. TC means total count. TC means differential count. Under that we have got neutrophils, lymphocytes, ESR, all that will be assessed. Hemoglobin, all that will be assessed under complete blood count. Then comes this blood type and cross matching. You should find out what is the blood group of the patient, whether it is RH positive or RH negative, then cross matching. All this has to be done prior to the surgery. Now, why you have to do blood grouping and blood typing is there can be chances that there is heavy bleeding and patient may require blood transfusion. Okay, so for that purpose, we are doing blood grouping, blood typing, and cross matching. Next is serum electrolytes. Now, most of the surgeries you will do all these investigations. Now, particularly when they undergo any cardiac surgeries, like we have got CABG surgery and all, that is open heart surgery. In that case, you will perform all the laboratory investigations and blood investigations because we want to assess that patient is not having any complications, whether patient is normal or not. So, you will perform all the blood investigations. But if it is a minor surgery, we need not send the patient for all the diagnostic procedures. Okay, what is required, only that we will send. Now, serum electrolytes is essential to know whether the person is having a normal renal function. Okay, or commonly you can perform your renal function test also, which includes your blood urea levels, blood serum creatinine levels, then BUN, that is blood urea nitrogen levels. Then electrolytes will mainly include your serum sodium, serum potassium, serum magnesium, or even your chloride levels and all. So that will come under serum electrolytes. Next is urine analysis. Urine analysis or urine examination can be performed most of the time to assess if there is any infection in the urine, whether the urine is of normal pH, all that you can assess. Okay. Next is chest X-ray. Now, most of the time, if they are undergoing any respiratory surgeries or cardiac condition surgeries and all, you will have to perform chest X-ray to know whether it is normal or not. Next is ECG. Now, ECG or electrocardiogram is commonly performed for most of the surgeries. Okay, prior to the surgeries, you can perform ECG. Now, sometimes patient will undergo some neurological procedures. Okay, maybe to remove the brain tumors and all. In that case, you can also perform EEG. EEG means electroencephalogram. Okay, so many different variety of diagnostic procedures can be carried on. It all depends upon what condition, medical condition the patient is suffering with, and nextly what type of surgery he is undergoing. Okay, other than that, they can also undergo prothrombin time, that is PT, then APTT, then INR, that is INR means international normalized ratio. So all this test can also be performed. Along with that, sometimes the most important test that has to be done is HIV and hepatitis B. Okay, so HIV and hepatitis B test has to be done for all the surgeries. Okay, because we want to know if the patient is having HIV or hepatitis B. Next is, I told that you have to collect a thorough history of the patient and you have to perform physical assessment. Now, while you are performing, you are doing the health history of the patient, you have to collect history regarding entire thing, like what are the complaints the patient is admitted with, what is the present medical history, what is the past medical history, what medications he was taking, or what disease condition he was having, since how many years he is having that particular condition, then any previous hospitalizations he was having, or he was having any previous surgeries, what type of surgery he has undergone, or what type of anesthesia was given prior, whether he is having any allergy for any food items or seafood, or most of the time we will even assess whether the person is having any allergies to any drugs. All this has to be asked with the patient. Next is, you can also see for their personal and nutritional history and ask if they are having any habits of consuming alcohol or chewing tobacco, cigarette smoking, or they are taking any other over the counter drugs. All this has to be asked in the history. Next is regarding physical assessment. Now, a thorough physical assessment has to be performed before the surgery. So, general survey can be conducted. You can perform a thorough head-to-foot examination. First of all, it is regarding cardiovascular system. So what you have to do is you can assess what is their heart rate, heart rhythm, what is the ECG that can be seen, or if they have had any changes in the cardiac conditions, because most of the time, individual who is having cardiac conditions may result in death. Nearly 30% deaths can happen during the time of surgery in the OT table itself, or even in the post-operative period. So a thorough cardiovascular assessment has to be done. Next is respiratory assessment. In that you have to assess the breath sounds of the patient, or you can find out the normal breath sounds and abnormal breath sounds. The abnormal breath sounds includes wheezing, stridor, wails and all. So check the ventilatory functioning of the patients, so you can assess if the patient is having any respiratory complications. Next is regarding renal system. In renal assessment, most of the time you can perform urine examination. You can also perform renal function test, that is RFT. And then you have to assess fluid and electrolyte balance, see whether the person is having any edema, especially of the extremities and all. Then next comes is neurological assessment. In neurological assessment, that is in the system, you have to see the patient's level of consciousness, whether the patient is able to follow your instructions. Okay. Then see if the patient is oriented to time, place and person. That all things can be done under neurological system. You should see that the person is not confused or disoriented. Okay. He should be able to follow the instructions well. Next is musculoskeletal system. So in that you can see if the patient is having adequate muscle strength, especially if you are going to perform any orthopedic surgeries, you will have to make sure whether the person is having normal range of motion. So that can be assessed in musculoskeletal system, and see if the patient is having any other complaints like pain and all. Next is GI system, that is gastrointestinal system. Now, under this gastrointestinal system, you have to see if the patient is having complaints like nausea, vomiting, or abdominal pain, or distension. All that can be assessed. Along with that, you should also find out regarding the bowel sounds, whether there are normal bowel sounds, if the patient is having constipation or diarrhea. All that has to be assessed. Next is head and neck. So under that you have to see the status of the oral mucous membrane. So most of the time we do it to assess the hydration level. Okay. Next is you can also find out regarding the drug history. Most of the time you should ask the patient if they were on certain drugs like antihypertensives or oral glycemic agents which we are taking for diabetes mellitus, then antiplatelets, anticoagulants, okay, like drugs like aspirin and all should not be taken before the surgeries. Most of the time what happens is, if you are taking this aspirin or clopidogrel and all before the surgeries, there are chances that it will result in bleeding. So you should see that at least 3 to 4 weeks prior to the surgery, you should withhold antiplatelets. Okay. And it is also advisable that you ask the patient not to drink alcohol or to quit smoking at least 3 to 4 weeks prior to the surgery. Next is regarding nutritional status. Now, under nutritional status, we have to assess if the patient is having obesity, okay, or the person is malnourished. Most of the time, if they're having any nutritional deficiencies, that itself may not be good for the person to undergo surgeries. Okay, even obesity, severe obesity also, they will not conduct surgeries. They will ask the person to reduce the body weight. Next is assessing the physical needs. So while you are assessing the physical needs, you should see for the ability to communicate, whether the person is able to communicate well, whether the person's vital signs are normal. This already I have told. Level of consciousness, he is confused or drowsy or responding or not. Then assess the weight and height of the patient to check the BMI. Then skin integrity. Okay, whether he is having any redness, peeling of the skin, anywhere, any problem is there in the skin, that also has to be assessed. Next is C for ADL, whether the person is able to perform activities of daily living. He is able to carry all the self-care activities by himself. Ambulation is possible or not, that has to be checked. Then level of exercise, whether he is able to perform the exercises well, or whether he is using any prosthesis, any artificial devices. It could be artificial limbs, or he is using dentures. Okay, that also has to be assessed. Next is assess psychological needs of the patient. Now, most of the time, a person who is going to undergo surgery will be very anxious, okay, or very fearful regarding the surgery. So, assess the emotional status of the patient. What are his coping abilities or support system? Whether he's getting adequate support from the family. All this has to be assessed. Then next is assess the cultural needs of the patient. Now each culture people will follow their own practices, isn't it? So what is their language, what is their culture, all this also has to be assessed well. Next is psychosocial assessment. So under psychosocial assessment, it covers the same things about I have already told. Okay, assessing the level of anxiety, what is their coping ability, all that will come under psychosocial assessment. So what you have to do in order to provide psychological support is most of the time you may need to explain the procedures prior. Before doing the procedures, you have to explain the procedures and all to the patient as well as to the family. And most of the time you will have to give an adequate information regarding the surgery. Most of the time, it is a surgeon who will explain what type of surgery is carried out, what will be the consequences of the surgery, what will be the risk or what will be the complications. That all things has to be explained well to the patient and to the patient party. Not only for getting the consent here, but also because it is the right of the patient to know what type of surgery they are going to undergo. Along with that, you will also have to explain what is the expected duration of stay in the hospital, how much time they will stay in the hospital, when they can resume the duty, what will be the cost of the surgery, or what treatment or investigations they have to undergo. That all things has to be explained by the surgeon, and the nurse will witness all this. And it is also the responsibility to reduce the fear or anxiousness of the surgery. Eradicate the fear of operating. You can also ask the anesthetist to explain regarding the type of anesthesia which will be given, what will happen after taking anesthesia, then what will be the condition of the patient in the post-operative period. All this has to be explained prior itself. Okay, so those all things does come under psychological preparation. And always remember that whenever you are explaining anything to your patient, it has to be explained in the language understood. Okay, so explain in the local language what the patient can follow. Next comes is legal preparation. So legal preparation refers to the consent. So remember, legal preparation means here they have to sign the consent. There is a consent form. Okay, the patient or the family members can sign it. Now most of the time, if at all the patient is mentally ill, or if it is a person or a child, or if the person is below 18 years of age, or if the patient is heavily sedated, critically ill patient or unconscious patients, these type of people cannot give the consent. So in that case, the family members or the guardians will give the consent. So here also see that the surgeon is explaining everything regarding the surgery. Then only the patient or the patient party will sign it. Next comes the spiritual preparation. So under spiritual preparation, you should encourage the patient or the family members to follow their own beliefs and practices. So each religion will have their own ministers. If they want to get their health ministers at the hospitals and follow the rituals, you have to allow the person to follow it. Next comes is preoperative teaching. So under preoperative teaching, it means that certain education or teaching will be given to the patient before the surgery. So most of the time, what health teaching are will you give to the patient before the surgery? Most of the time, it will include regarding your deep breathing and coughing exercises. Now, deep breathing and coughing exercises usually will reduce the chest complications after the surgery. But before the surgery itself, in the preoperative period, you will have to explain regarding deep breathing and coughing exercises. What are the different types of exercises, how it is performed, that can be explained in preoperative period. Next is regarding postural drainage. Postural drainage is a technique in which different positions will be given to drain the secretions from the bronchial airways usually. Yeah, this secretions will drain by gravity and most of the time it will reduce all sorts of chest infections and all. So under this postural drainage, we have got certain types like we have got percussion, then vibration. Okay, so these methods are usually used in order to perform this postural drainage. So that we will see in detail later. Next comes is chest physiotherapy. Chest physiotherapy is usually given by the physiotherapist and nurses will can assist the patient in this. So that also we will see in detail in the post-operative period. Next is you should always explain to the patient that you have to control the number of visitors after the surgery is over because most of the time visitors can cause cross infection to the patient. So restrict the number of visitors. Then ask the patient to maintain good personal hygiene, especially before the surgery. Then you should always explain to them to have an NPO status. NPO means nil per oral. Okay, so nothing will be given through the mouth. That is at least 12 hours before the surgery. Okay, why you don't give anything is in order to avoid aspiration during the time of surgery. Okay, so tell the patient to have 12 hours of fasting before surgery. So at least from 12 midnight, they should not consume anything. Okay, so why preoperative teaching is essential? Because most of the time it will mentally prepare the patient for the surgery and the nurse will know what to expect from the patient and even the patient will have a clear vision what is going to happen during the time of surgery. Okay, so in preoperative teaching, some other things that you need to tell is regarding pain control and pain management. So you have to tell that after the surgery, the patient may experience pain. What will be done to reduce the pain? That can be told. Or you can also explain regarding the pre-medications that will be given. Or you can teach some leg exercises. Or you can also teach regarding changing of positions. Then also teach regarding incentive spirometry. Now this incentive spirometry you can see in the figure it is having 3 balls here. Okay, so this is a part of the spirometry. It is having a mouthpiece. It is having tubing. Then there are balls here. Okay, and in this type of spirometry there is a marker as well as a piston. So ask the person to take a deep breath. After that they have to keep their mouth in the mouthpiece. Okay, and then they have to blow the air here. Okay, you can see that when they are blowing the air, the balls will move upwards. Okay, so that is your incentive spirometry. So that also is a sort of breathing exercise that can be given to the patient. Other than that, you can also tell the patient regarding this NPO status even after the surgery. Okay, so after the surgery, they will not be allowed to eat and drink. They will be placed on NG tube, that is nasogastric tube, or they will be they will be kept on IV fluids. Okay, or total parenteral nutrition. So these things has to be explained in detail in preoperative teaching for the patient. Next is physical preparation. So under physical preparation comes as part preparation. Okay, most of the time you will have to shave the part. Now each hospital will have their own policies. Presently, part preparation is not done, only trimming will be done. Okay, certain hospitals follow the procedure of shaving the entire part. For example, in case of abdominal surgeries, what you will do is you will have to prepare the patient from the axilla to the thighs, including your private part and all. It could be shaved. Okay. So that will come under physical preparation. Along with that, what you have to do is bowel and bladder clearance also has to be done. Now, bowel and bladder clearance means you will have to give a enema in the evening prior to the surgery. Okay, so that you can empty the bowel. And most of the time, before you send the patient to the surgery, they will advise to put a Foley's catheter. Okay, so that also can be done. Next is on the night before the surgery, you can give a mild sedation. If at all the person is having lot of anxiety, is not able to sleep, in that case you can give some mild sedatives or anxiolytics. Okay, but you should advise that patient should not consume any sort of food after 12 midnight. Next is immediate preparation. Now, immediate preparation means just before you are sending to the surgery, what and all activities you have to carry out. So, first of all, it can include that early morning, as soon as the patient gets up, they will have to perform mouth care, they will have to go and empty their bowel and bladder. Then immediately before sending for surgery, see that you are removing the nail paint, that is your nail polish is not there. Okay, you have to remove the hairpins, clips, ornaments. If they have got artificial dentures, artificial teeth and all, that also has to be removed. Okay, chances are there that it could be aspirated and all. Then next is you have to comb the hair of the patient and tie it with the ribbon. Ask the patient to put on the hospital gown. Okay, and the certain hospitals will also follow a policy like they have to have a thorough bath sometimes before the surgery, and some hospitals also follow a procedure of catheterizing the patient or putting NG tube prior, or even putting a cannula for the patient before the surgery. Okay, so most of the time before you send the patient for the surgery, they will be performing. They will monitor the vital signs also. Okay, so performing the vital signs also plays a very important role. Then next comes is pre-medications. So most of the time before sending the patient to the OT, that is a operation theater or the operating room, you will give some pre-medications like opioids can be given to reduce the pain of the patient. Okay, IV it is given usually. Next is antiemetics can be given to reduce your or to prevent nausea and vomiting. Then benzodiazepines or sedatives can be given. Antacids could be given. Okay, all these examples we will see in the system wise when we are studying. Then next is H2 receptor antagonist, that also can be given to the patient. Then next comes is prophylactic antibiotics. So most of the time test dose will be given to the patient, and then full dose can be given of the antibiotics before the surgery. Okay, then see that the patient has removed all the jewelry, makeup is not there, they have removed eyeglasses and all before the surgery, and then you can put on the OT gown. Okay, and you have to put the patient's ID card. In the ID card you can write the patient's name, age, and then you can transfer the patient into the trolley and shift to the operating room or to the operation theatre. So when you are shifting the patient, see that one nurse is accompanying with the patient along with the family members maybe until the operating room. Next is nursing diagnosis. You can frame your own nursing diagnosis depending upon what are the problems of the patient. No, I have written here anxiety. So patient can have anxiety. Okay, so anxiety related to the post-operative pain or results of the surgery. Then next is the person can have deficient knowledge. Okay, so knowledge deficit or deficient knowledge related to preoperative procedures. So that also could be framed. So this is the preoperative checklist. Usually each hospital will have their own checklist. So they have to fill the name of the patient, time, then who is a surgeon, who is anesthetist, then whether consent is taken, what is the height, weight, what are the vital signs, what is the urine report, okay, X-ray report, ECG, ultrasound, whether it is done, then what other lab investigations are done, HIV, hepatitis B, all this has to be marked in the pre-operative checklist. So all this is an important thing that has to be carried out before the surgery.